Hi, my name is Sebastián Rojas Munera. I'm a third-year resident in ophthalmology at Universidad Pontificia Bolivariana, Medellín, Colombia. Today, I'm going to talk to you about capsular block syndrome. CBS is an uncommon complication of phacoemulsification, characterized by accumulation of liquid between the posterior capsule and the IOL. Patients could be asymptomatic or develop ocular hypertension and glaucoma. In some cases, visual acuity can be decreased due to myopic shift induced by anterior displacement of the effective lens position, or secondary to accumulation of a retrolental white liquid. Depending on time, CBS can be classified into intraoperative, early postoperative, or late postoperative. During intraoperative CBS, passage and accumulation of liquid between the posterior capsule and lens nucleus occurs during hydrosection maneuvers. This situation can cause posterior capsular ruptures with subsequent lens luxation to the vitreous cavity. Careful hydrosection and wide capsulorhexis reduce the occurrence of this complication. Early postoperative CBS occurs during the first 2 weeks following surgery. Retrolental viscoelastic devices may induce an osmotic gradient that fills retrolental space with liquid. Another consideration is that capsulorhexis with adherents that compromise more than 70% of the border tend to act as a valve mechanism that allows the unidirectional passage of liquid into the retrolental space. Lactocruminacia, or late postoperative CBS, occurs several years after surgery. The main characteristic is the deposit in the capsular bag of white material derived from epithelial cells. Compromise of visual acuity and increase in the IOP are uncommon. CBS can be diagnosed in patients with postoperative myopia or refractive surprises with a shallow anterior chamber and a distended capsular bag with IOL separation are found. A definite diagnosis and a better characterization of anatomical structures can be achieved by the use of diagnostic aids, such as an anterior segment ultrabiomicroscopy, optical coherence tomography, and chain plug-based photography. Observation is a viable option for some patients, particularly during the first month after surgery. Topical steroids can be all that is required to reverse capsular block in cases of post-surgical CBS, in which inflammatory processes are the predominant causative factor. Anterior and posterior capsulotomy is the treatment of choice for early postoperative and late postoperative CBS. Finally, needle revision is relatively easy to perform and doesn't involve the cost of an additional surgery for the patient. This treatment doesn't require the use of laser and can be performed as soon as 1 day after surgery.